from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we kick off a behavioral health mini-series. Today, we're going to be discussing the youth and adolescent patient population. Our guest today is Dr. Connor Malloy, a psychiatrist at the Cornell Behavioral Health Pavilion at SMH. Dr. Malloy, thank you so much for joining us.
Thanks for having me on.
Could you start by describing the types of challenges you're seeing youth and adolescent patients struggle most often with?
So in my day-to-day work, the thing that I see the most is depression and anxiety. I also see a lot of children and teenagers that have issues with impulse control disorders, some externalizing behavior and conduct disorders. But the vast majority of the patients that I am seeing in practice right now are kids who are suffering with depression and anxiety.
Has this changed over the years?
In terms of relative prevalence of depression and anxiety compared to other mental illnesses, not necessarily, but I do think we are seeing a rise in depression and anxiety amongst the youth age group. We are kind of in the midst of what we would call a mental health crisis, or for lack of a better word, a mental health pandemic amongst our youths. Adolescent, the boys and girls are much more likely to be diagnosed with depression and anxiety than their adult counterparts at this time. So I certainly would say it's been amplifying recently.
Do you think it's because there's actually more youth and adolescent who are depressed or have anxiety, or is part of it because people are finally seeking help and maybe actually being diagnosed more regularly than they would have been?
I think it's probably a little bit of column A and column B there. Okay. I think the younger generation is much more ready to talk about these kinds of things. What I have found in practice is that, our Gen Alphas are very, very active in talking about their mental health. And so they are probably getting in front of people who can diagnose them with these individual issues more often. But I do think that, the unique stressors of our day, the state of the society that we live in are certainly playing a factor into that. So, like I said, I do think it's a little bit of both things.
How has technology and social media use impacted this population specifically? I know that it impacts every population at this point, but let's talk about, for youth and adolescent, how has that impacted them?
It's really a double-edged sword. One of the things that I hear a lot from my patients is that their phone or their tablet or their computer or their access to social media is very, very important to them. Mm-hmm. They feel like they get a lot of comfort and support from these things. But I think one of the things that our youth population is not recognizing, or maybe the detriments of social media and constant access to those things, there is constant pressure to feel like you need to be in contact with your friends at all times. There is kind of that fear of missing out that we call, the FOMO category of things, where kids feel like if they're not constantly talking to their friends, then they are being left out. And, even spending a couple of times away with family to go on a vacation without their phone or without their iPad can be something that causes kids lots of anxiety because they're used to constantly being online. And that's before even talking about what they're interacting with online, which sometimes can be fairly harmful material. Sometimes it can be supportive, and sometimes it can be in this, gray zone.
And how does that impact sort of the bullying issues? I know cyberbullying is a big topic of conversation. It used to be that if you were bullied, you could maybe go home and shut it off, or be in a safe place with your family or friends close by. How has the internet impacted that population?
Yeah, like you said, it used to be that, okay, you could get away from the kid who was stealing your milk money at school by just going home, and now it follows you everywhere you go. Kids are encountering these things on, TikTok, Snapchat, Instagram, whatever kids are using. And some of this is really hard to track too. I mean, we have apps now that have disappearing messages, and so it's hard to verify that these things are happening when kids are telling you, like, these are terrible things that my classmates are telling me online. And so not having these kids get a respite from the kind of toxic nature of some of these conversations has been really, really challenging for a lot of our kiddos.
And you mentioned the double-edged sword. A big part of depression can be isolating yourself. Does social media ever kind of act as a positive thing to like reconnect some of those people who might try to isolate themselves?
Yeah, this was something that I was really interested in. I actually, in a former position, I did some focus groups with kids who were dealing with depression and anxiety about their use of social media. What are you guys using social media for? What would you like adults to know about your social media use? And a lot of them were telling me things about how positive it was for them and how it helped them even find community amongst other kids or teenagers that were dealing with similar issues. Now, one of the things that was a little bit concerning about that is there's also been research that shows that like really popular accounts that are posting things about depression and posting things about anxiety are often posting things that are misinformation about depression and anxiety. So it's tough because kids are going to these websites for support, but may not be getting accurate information about what's going on with them, or may not be getting the right type of support or the thing that's going to be most helpful for them.
And it's, of course, not just the internet and social media. Can you talk about the factors like family stress, academic pressure, even global events, and how that's impacting this patient population?
Yeah, so those are things that are fairly consistent over time. Family stress, disruptions to the household. There's been immense amounts of research about disruptive upbringings, what we call adverse childhood experiences. For instance, even parental separation, even amicable parental separation can be a really big stressor for kids. Seeing things like your parents, have contact with the police or domestic violence or even significant verbal arguments, those things can really affect kids growing up. We see a lot of kids that have dealt with some significant family dysfunction in my current work in inpatient psychiatry. You asked about the current state of kind of global politics or things that are going on socially, and regardless of what side people are taking, there's a lot of animosity that exists, and kids are definitely not immune to that. They're more online than adults are, and they are seeing all of it and hearing all of it. And they are in this stage where they are trying to form their identity and form who they want to be in the world. And they're trying to do that in a world that to them is very uncertain.
Interesting. What role can parents or caregivers play in identifying and supporting kids who may be struggling?
So identification is tough because parents aren't professionals. However, the things that parents are experts in is their own kids. They know their kids better than anybody else, and so they can identify changes in behavior. And if they notice a change, a significant change in a discrete period of time from their kid, that may be a time to just have a conversation with their kid about how they're doing. Not necessarily trying to pin them down and ask them what's going on, what's wrong, but just say, hey, I've noticed that you may be acting a little bit differently. Tell me how you're feeling. And that can be a good way to open the door to those conversations. One of the things that I see parents struggle the most with is they'll tell me, I had no idea this was going on with my kid. And kids will tell me, well, I've wanted to talk to my parents about it for a long time, but I didn't want to disappoint them, or I didn't want to make them upset with me. So parents coming at this with a kind of open mind, letting their kids know, I'm not going to be disappointed with you if you tell me that you're feeling bad or you've had thoughts that are maybe, pretty dark. I just want to help you, and I love you, and I'm here to support you.
That's a really good point. But this is also a population that goes through a lot of changes very rapidly, whether it's growth, whether it's development, whether it's brain changes, hormonal, whatever. How can parents try to identify what's a simple hormonal shift that a kid might struggle with temporarily versus this is something that maybe we should seek professional help for?
Yeah, I think that's the hardest part, right? What is, a teenager being a teenager and not wanting to hang out with mom or dad as much, or what is something that is significant depression, or what is something that is significant anxiety? And I think it comes down to function. If you notice that your kid is no longer functioning in those aspects of life that are kind of expected, so for instance, is your kid spending so much time in the room, not just away from the family, but not talking to any of their friends? Are they not going to school? Or do you see a dramatic decline in their school performance over a short period of time? I think those are the big red flag kind of warning signs that this maybe goes beyond what is typical for kind of that teenage angst that we call it.
Yeah. And in the even younger population, how does a parent know this is a tantrum and maybe age appropriate because my child doesn't yet know how to communicate their emotions versus these emotions are getting out of control or something is not right here?
Yeah, I think a similar answer there. It all goes down to level of function. Is your kid having to be pulled out of class, frequently because of these tantrums? Are you able to bring your kid to the grocery store and go shop for 15 minutes without having one of these tantrums? And kind of the length of time when we talk specifically about temper tantrums is important. Can your kid be soothed after they understand that they might not be getting what they want? Or does this just last and last and last until you actually do have to change settings and you have to leave the place? Those can be indicators that maybe there is a more significant developmental issue going on than just a simple temper tantrum.
What new or emerging treatments or approaches are proving effective with young patients now?
So, maybe not a new approach, but something that we're seeing emerging is something that kids are being more open to, is a lot of kids are more open to going to therapy regularly, kind of your regular cognitive behavioral therapy and working through cognitive distortions. Some of the more emerging technologies for things like treatment-resistant depression, things like TMS, haven't quite made it to the youth and adolescent population, but I think those are going to be emerging treatments. And certain newer therapies that are specific to things like trauma, like EMDR or eye movement desensitization and reprocessing, has been something that a lot of patients have told me has been very helpful for them.
Can you talk about some of the programs available to these patients specifically at the Cornell Behavioral Health Pavilion?
Yeah, so we've in the youth population, we kind of serve two big groups. One of those is on our inpatient unit. That is for kids and adolescents that are going through significant mental health crises. So that's what we call like an acute crisis stabilization unit. It is a primarily group-based intervention. It's a beautiful facility. We have multiple group rooms, multiple groups throughout each day from multiple different therapists, learning things like anger management, impulse control, dealing with negative thoughts and self-harm thoughts, and even dealing with difficult conversations between family members. We also on that unit have a gym available to the kids. So when they're there, most of the kids are there under a Baker Act, but they have oftentimes ability to engage in recreation through the gym. We have a sensory room. We have patios there. So it's a really tremendous facility. If you have the unfortunate event where you do have to be hospitalized, Cornell is a wonderful place. And then from the outpatient standpoint, we have an intensive outpatient therapy service. It's a group that runs about 10 to 12 kids, again, primarily a group-based intervention that might help mitigate some risk in kids that are higher risk for things like self-harm or for, to avoid hospitalization. And sometimes we actually do have kids that were hospitalized and then will step down to care in the intensive outpatient program. I'm the medical director of that program currently. We have 3 full-time therapists on staff, a coordinator for the program on staff. We've gotten great feedback from our families and our kids that it's been helping them with significant episodes of depression and anxiety, as well as other things. That program is 9 hours a week. So they will come, it's primarily for kids that are in high school. So they come after school gets out around 4, so from 4 to 7 p.m. on Mondays, Tuesdays, and Thursdays.
How important is it to have both the inpatient and outpatient programs sort of under that same umbrella, under the same roof, and available to that patient population?
It's very, very important because I think it helps identify our staff downstairs to identify kids that are kind of teetering on the edge but don't necessarily need to go to the hospital, for an inpatient stay, but we can offer them the service of, hey, we have more intensive services available as an outpatient that we think would be very, very helpful for you, rather than someone needing to be hospitalized. And then vice versa too, giving us the peace of mind from an inpatient setting. We're dealing with a kid or a teenager who has gone through a significant crisis. There still might be some risk there, but it gives them an opportunity to be in front of more professionals more often for a 6 to 8 week period.
What is that line where it goes from maybe outpatient therapy or outpatient programs are good to this is something more? What is the line where this is an inpatient situation?
Yeah, that's a tough question, and it's often something that I'm asked. It's part of my role is to kind of stratify risk, and it's all about risk. If there is an imminent risk that this kid or this teenager might do something to harm themselves or potentially somebody else, then it's likely that we'll suggest that they go inpatient for a brief period of time. But if there are, thoughts that a child or teenager is having that aren't necessarily things that child or teenager is planning on enacting, they might be appropriate for an intensive outpatient service to help get them through some of those things.
If they might not need something as intensive,
Mm-hmm.
but they do need help, what other resources do you point your patients to?
Yeah, so often that's when we lean on our community partners. There are several organizations in the area that will provide therapy and actually provide psychopharmacological services too. So providers that can prescribe medications if need be. It's not every kid comes in and needs to go on a medication for depression or anxiety. Oftentimes, I'll talk with parents about that. Hey, the suggestion is, let's try therapy first, and if you feel like therapy isn't going in the right direction, maybe we consider medications later on. But there are a number of different community resources that we often refer to. One of those is, Elite DNA. That's a company in the Sarasota area. For if you're just looking for therapy, I always recommend parents look on Psychology Today. It's a website free to use. You can look up available therapists in your area and also see if they take your insurance. And then always recommend NAMI as a good resource. That's a great community resource. They're countrywide. You can plug in your zip code and find support groups in your area too.
How do you engage adolescents who might be resistant to therapy or reluctant to talk about their emotions? Because I know you mentioned that this generation tends to be less resistant, but that's not true for everyone, of course.
Yeah, I think it starts with trying to understand where the resistance comes from. Because, if a kid comes in and says, well, I don't want to do therapy, and then I just say, well, you need to do therapy, that obviously isn't going to work. I have to do a little bit more on my part to understand why exactly it is that they don't want therapy. And sometimes the answer is as simple as, well, I've already got my friends that I talk to, and so I don't really need a therapist because my friends make me feel better. And oftentimes that's when I have the conversation with them about, well, what if you are mad at your friend? Then you don't have a therapist anymore. And most of the kids, hear that and go, oh, that's probably a good idea that I see a professional about these things. And then other times it's trust. It's building trust too. So sometimes it is helpful when I see kids either in the inpatient setting or the outpatient setting to just be a friendly face, be someone that they feel like they can trust, and show to them that they can trust other professionals in the field too, because it's hard for kids to talk to adults, strangers that they don't know, about things that are really hard for them to talk to anybody about.
I know that there is a national and international movement to destigmatize the need for mental health assistance. How important is that specific to this patient population?
Very, very important. I think this patient population uniquely has done a better job of destigmatizing it on their own. I mean, like I said, you've got a generation of kids who is more willing to talk about it with their friends all the time. I hear kids talk about their medicines with each other or talk about their therapists with each other. And so I think there is been a lot of really good work that we have done to destigmatize mental illness amongst this population. I think one of the things that we still need to continue to do is destigmatize it amongst parents too. I think a lot of parents can feel like embarrassed if their kid is admitted or needs intensive therapy, but there's really no reason to be embarrassed by those things. Like we've talked about, kids are really facing a lot of challenges these days. And parents becoming less destigmatized to it and being open about the challenges that they're facing as a family can be very helpful too.
And do you think it shapes a child's willingness to address mental health if their parents are willing to address their own mental health as well?
Yeah, absolutely. I think it kind of goes back to that, one of those original points that we were talking about, the reasons that kids might not tell their parents about things. And if they see that their parent has been open with their own struggles, or their parent is, willing to be kind of a sounding board to their thoughts that they didn't think were appropriate to talk about before, that will definitely help them open up and may help identify some problems before they, get worse or can cause harm.
If you could give one message to parents or caregivers listening today, what would it be?
Just be supportive. Listen to your kids and be supportive. Those two things will go a very, very long way. And then, sorry, you asked for one, but I'm going to give a third. Listening, being supportive, and then identifying positives and praising those things. So if your kid does a really great thing and you're really happy with them, praise them for it. Because, it's oftentimes easier for parents to discipline when kids are doing things that don't want to be, parents don't want to see. But being a positive reinforcer of positive behaviors, kids respond so well to that. Just be open, be honest. Don't feel like you have to hide things. This is, we live in a world now where people are more willing and more accepting to hear those things. And so being open and being honest will get you the help that you need much quicker. And it can really relieve a lot of that angst and a lot of that anxiety.
Thank you so much for joining us, Dr. Malloy. And if you liked this episode of HealthCasts, please like and comment and visit smh.com/podcast to listen to more experts like Dr. Malloy talking about the health issues which matter to you. The Behavioral Health mini-series will continue with our next episode. As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.